Hi, so we're doing this week's segment of Functional Medicine Back to Basics. I'm Dr. Martin Rutherford, certified functional medicine practitioner, chiropractor. I am the clinic director here at Power Health in Reno, Nevada, and the author of Power Health Back to Basics. And a lot of what we're doing in this series is back to basics for those of you who just looked at this one because you were scratching your head wondering what oxygen had to do with anything as far as getting better, and you clicked onto this. This is part of a series on functional medicine. I'm presenting classic functional medicine principles because I've been in practice a long time. I was one of the early functional medicine practitioners, and now I'm seeing a shift where I'm getting a lot of people who are coming in who've already been the functional medicine practitioners. It hasn't worked. And I have another group of patients who, well, not patients, but we have another group of viewers. For those of you who haven't seen us, we have about 600 hours discussing chronic pain on powerhealthtalk.com. We have a lot of viewers who have asked over a period of time, okay, you've told us what it is and we feel good about that and it's great and I know I'm not crazy, but now tell me how to fix myself. You're holding back on me. And we're not holding back on you, and that's what this whole series is about. We've talked about what functional medicine is, obstacles to cure. We've talked about how a functional history should be taken and how it's pertinent. We've talked about how a functional exam should be done and how nobody does exams anymore, and that there's so much data that you can get to them, particularly in the functional world. And then we talked about testing last week. I think we did testing last time. So the series goes on, and now we're going to start to get into a little bit of what you might call treatment. But if you've seen any of the other presentations, you'll know that I have said that one of the reasons that what you're doing online, or what a functional medicine practitioner who may not be taking the time to practice functional medicine, why those things will fail is because you are missing the basics. And over the next couple of weeks, we're going to be going over what foundational things need to happen for your physiology to work properly, and the basics. You take supplements, you change your diet. Everybody wants to know about diet. We're probably going to talk about diet a couple of segments from now extensively, and I think that'll be very interesting because everybody wants to know about that. So everything online is diet and supplements, but I took them and they didn't work. This whole series is about why you took them and they didn't work, or why you took them and they worked for a little while and then they didn't work, or why the diet worked for you but it didn't work for your neighbor, and on and on and on. And if you really are practicing functional medicine, you should cover all of those bases for the patient. You should know what diet they need eventually. And there's not a lot of diets that you really need to consider. You should know what supplements that person needs. And I had a lady come in here the other day and she was literally taking like over 30 supplements multiple times a day. We're going to talk why that's probably not the way to go. But today we're going to get we're going to get to oxygen, okay? We're going to talk about following the fuel. So the first thing of the basics of getting better is to follow the fuel. Now, what is the fuel that makes our physiology work? The two main fuels that make our physiology work are oxygen and glucose, okay? And don't underestimate the supposed simplicity of where I'm going with this, because we're going to talk about glucose in our next presentation. Okay, today is going to be strictly about oxygen. And people say, well, I get oxygen if the person's like can't breathe and they've had a stroke or they've had COPD or something like that, they need oxygen. But the reality is most of the people running around on planet Earth, or at least in this country, and we're finding out several other countries from people who come here, they don't have enough oxygen going to their extremities. They don't have enough oxygen going to their brain. And a lot of us would argue that means they don't have a lot of oxygen or enough oxygen going to their enteric nervous system, meaning the nervous system that controls your intestines. So oxygen is kind of vital. I think most of you realize that if you stop breathing for a short period of time, that probably would be a good representation of how important oxygen is. Okay, but on a subtle level, we need oxygen to make energy. Okay, if functional medicine is about anything, it's probably about looking at all of the organ systems in the body, all of the feedback mechanisms in the body, all the biochemical systems in the body that contribute to chronic conditions that are not working, and balancing them. I had a person who came in yesterday and the day before, and she said, and I'm taking all of these things to boost my immune system. Frankly, most people come in here don't need to boost their immune system. They need to balance their immune system. In fact, we need to balance everything. It's really about homeostasis. It's about getting your body back in balance to the degree that is possible based on your present condition and the amount of tissue damage that you might have incurred or not incurred. And oxygen is kind of, oxygen and glucose are kind of the beginning, where you begin with getting your physiology better. So what about oxygen? You need oxygen to create something, to create ATP. ATP, you might know better in the term as a term of energy. Okay, energy is made in your mitochondria, and I'm not going to get into the whole Krebs acid cycle, but there are these little things, these little organelles in your cells. They're called mitochondria. Most of you have probably heard of them. And mitochondria, when they're not working, not only create fatigue, but they create an imbalance in your system. You cannot create homeostasis. To the degree that you can or cannot create homeostasis, you can or cannot help that patient's physiology to help them to overcome many of the symptoms and many of the conditions that they have. So it all starts with oxygen. Sleep apnea is something that is on the top of our list of evaluating when patients come into our office with chronic problems. I don't care if you're coming in with dizziness, vertigo, balance migraines, irritable bowel syndrome. I don't care if you're coming in here with fibromyalgia, peripheral neuropathy, chronic fatigue. You don't have enough oxygen going to those extremities. You don't have enough oxygen going to the brain. You don't have enough oxygen in the cells. It's not happening. One of the biggest violators of oxygen is sleep apnea. And I was actually turned on to this by one of my mentors. And I remember sitting in the class and I was kind of like taken back by it. It was like, sleep apnea. Like, wow. And he went on to say, well, sleep apnea causes diabetes, it causes heart disease, it causes liver problems. Sleep apnea causes weight gain, it causes heart disease, it causes stroke, it causes neurological diseases, it even causes spinal or brain stem problems. And it's listed as one of the top 2 causes of erectile dysfunction. All of these conditions are conditions who walk in here. So he kind of got my attention on that. And as I delved more and more into sleep apnea, I started to realize that it creates a massive oxygen deficit. I came back to the office after that presentation, and I started asking a lot of my patients, have you been diagnosed with sleep apnea? Here's what I've got. Here's what I got. Well, yeah, somebody told me that I had sleep apnea a while ago. My husband says I snore all the time. My wife says I snore all the time. My husband says I have to he has to wake me up because he doesn't know if I'm like breathing or not. But I don't know. I didn't really go get checked for. I went and got checked, and they told me I had sleep apnea, but I didn't really follow through on it. They didn't tell me like whether it was that important or not. Or, yeah, I got diagnosed with sleep apnea. So my next question for that person would be, are you using your CPAP? Man, I hate that thing. It's on my face. It doesn't work right. It bothers my sleep. And the statistics that were presented in the class were that only 30% of the people who are diagnosed with sleep apnea use their CPAPs. That was about the statistics I saw in answering my, in questioning my patient population. But what was more stunning was almost 80% or 70 to 80% of the people I asked said, yeah, I've either been diagnosed with sleep apnea, I've been checked for it, I've been told I have it, or I have it for sure, and I'm using my CPAP, or I'm not. That was pretty stunning. The next thing that I did was tell people, okay, if you don't start using your CPAP, we're probably not going to get as good a result as we get. The results varied from mild to moderate to doc. I don't know if I need to do your program anymore because my peripheral neuropathy is better, my dizziness is better, my vertigo has gotten better, I'm sleeping for the first time in 20 years. So yeah, it helps. It helps. Getting the energy in there has helped. My hands have gotten warmer. It seems like I'm responding better to the program. But following the fuel, getting the proper fuels into your system is critical to being able to have your supplements work better. Your supplements part of them will work by breaking down and then becoming part of this Krebs acid cycle, citric acid cycle, that creates energy. You need energy to get better. So sleep apnea is like, it's like on top of the list. If you're not making oxygen, and sleep apnea, I now think, is one of the top causes that I see here in my office. You're just sitting around making lactic acid. Lactic acid is that stuff that burns when you're doing exercises or you're lifting something and your muscles start to burn. And there's a whole chemistry behind why that burn is there, and it's there to help you to get more glucose into your muscles. But you shouldn't be sitting around burning. You shouldn't be sitting around creating lactic acid because you don't have enough oxygen in you. And you're making a lactic acid because you don't have enough oxygen to lift the heavy weights and those types of things. And that's highly inflammatory. So not having oxygen in your body, what is one of the keys that we will talk about eventually, one of the keys to overall chronic pain? Well, one of the keys in most cases is chronic inflammation. Okay, and you become, as a functional medicine practitioner, an inflammation hunter. And one of the things that causes inflammation significantly is lack of oxygen. So sleep apnea is a topic that is on the top of my list when I'm talking to my patients. Every patient that walks in here gets their blood pressure taken, and all of you get your blood pressure taken, and you go to the doctor, and the doctor says, wow, you have low blood pressure. That's really great. You know, you're never going to die of a heart attack, and you're never going to die of a stroke. Well, you may not die of a heart attack, you may not die of a stroke, but you're probably not going to get better either. And you're probably going to have chronic problems because low blood pressure creates a situation in which you don't get enough oxygen going to your system. When you have low blood pressure, you're not getting enough oxygen going to your head. You don't have enough oxygen going to your extremities. You don't have enough oxygen going to your feet. So this is, if you have cold hands and feet, and you've tried to get your cold hands and feet better by doing a number of things, one of the things that will cause you to not have enough oxygen going there is low blood pressure. You need enough blood pressure. You need a high enough blood pressure, preferably high enough meaning normal blood pressure, for you to be able to create enough of a pressure so that your heart here in the living room, okay, needs to be able to get the blood up into the attic to your brain. You need it for that. You actually need blood pressure, higher blood pressure, more normal blood pressure, so that you can literally, without getting too scientific, push the nutrients in through the cell walls or through the arterial walls into your cells. If you don't have enough pressure there, you're not going to be able to get the nutrients into your cells. And so all those supplements you're taking, you've heard I'm taking supplements, maybe I'm not breaking them down, maybe I'm peeing them into the toilet, maybe all of that's true. And we'll talk about that when we talk about supplements and the nuances of that. But low blood pressure is something that needs to be corrected because low blood pressure will not get things where they need to be. If you come in here and you have dizziness, vertigo, balance, headaches, you have anxiety, you have depression, you have panic attacks, you have fatigue. These are all, the brain is a big part of all of those, okay? Many of you watch know that we practice functional medicine. We also practice functional neurology. This series is not about functional neurology, it's about functional medicine. But you also know that we practice them both because everything that affects the brain, everything that affects, that it's affecting you affects the brain chemically, and the brain pretty much controls everything else and affects the rest of your system. So we put the two together and it seems to work pretty well. So the brain needs proper blood sugar, which we're talking about next week, right? Proper fuel. It needs absence of inflammation, which we'll be talking about in a segment in the future. It needs proper essential fatty acids, which we'll be talking about in a segment in the future. And it needs proper oxygen. Your cerebellum, the part of your brain that's down here and it has a lot to do with dizziness and vertigo and balance and postural muscles and blurred vision, and it synchronizes your whole brain, uses something like 40 or 50% of the oxygen that comes into your body. Okay, so we need the oxygen to be able to get brain function feel normal. It's hard to get a brain to work if the chemistry is not right, and oxygen is probably the biggest player. I almost have to say oxygen and blood sugar and inflammation are close, but oxygen is definitely the #1 player. If you have low blood sugar, that's 80/60 for a young person. If you have blood pressure for an older person, that's 90/65, maybe even 100 under 100 over 70. You know, you're not getting blood to your brain. You're not getting blood to your brain. You're not getting blood to your extremities, and so and you're not getting blood into the cells. And if you have high blood pressure, most people know. We have a big thing in this country about like high blood sugar. We're going to talk briefly about that in the future, but we're going to talk a lot about low blood sugar. Okay. Well, hypertension, most of you are familiar with. High blood pressure. High blood pressure does a lot of bad things. One of the things it does is constricts your arteries. If it constricts your arteries, same thing. It constricts your arteries. You get vasoconstriction. You can't get the blood where you need to get it. And so blood pressure is vital for us. Normally, blood pressure is a part of what we need to address anyway to help that person to normalize. And this is considered, again, this is considered foundational to us. Getting the blood pressure under control is considered foundational to us. You come in here with 3 blood pressure medications, that's kind of a red flag. That means like, wow, we have 3 blood pressure medications. We got an issue here. We got to get under control because that's doing a lot of bad things, including not allowing us to get, let's say, the nutrients that we're using with people to get where they need to go. So again, oxygen, high blood pressure, low oxygen, sleep apnea. They're kind of foundational things, okay? What else would cause lack of oxygen? Okay, going through. I heard 3 of you out there say anemias. Okay, anemias cause lack of oxygen. That's a kind of like a duh. If I have anemia, I don't have oxygen. Okay, for those of you who don't know the chemistry of anemia, basically, your oxygen's carried around your system and delivered to all the different places by your red blood cells. If your red blood cells are low, you have low red blood cells, then you have an anemia, hard to get oxygen to different places. The anemias we see the most are iron deficiency anemias. We see B12 anemias, and they need to be corrected, and they're fairly easy to correct. You give the person iron, you give the person B12. But we get, the one we see most commonly is the anemia of what we call the anemia of chronic disease. Now, that's not the anemia that you've ever heard about, most likely. If you have it, you've heard about it like this. You have chronic anemia, and we've checked everything. There's no bleeds, you don't have fibroids, you don't have any of the reasons, you don't have ulcers, you don't have any of the stuff that would cause the chronic anemia. So we don't know what it is. We don't know what it is. It's probably normal for you, so just live with it. Well, it's not normal. Anemia is anemia. If you have low blood cells, you're not carrying oxygen to your brain, to your extremities, to your intestines, to your feet. It's just not getting there. So what we have come to understand is that chronic anemia is usually an anemia of chronic disease. Now, it can be an iron. When there's inflammation, iron will not break down properly and get into your bloodstream. And thus, you'll have low iron in your bloodstream and you'll have an anemia. What causes that? Anything that causes inflammation can cause that anemia. So, I mean, to just hit a few, you could have high blood sugar, that causes inflammation. You could have low blood sugar, that causes inflammation. You have gut infections, that causes inflammation. You can be stressed, that causes inflammation. You can have an emotional trauma stress, which you've had your whole life, that causes inflammation. And on and on and on, and we're probably going to do a segment on inflammation. So these chronic anemias that people have, these are significant. They're not, when you're told, oh, that's normal, it's not a problem, don't worry about it. It could be a gluten sensitivity. You know, it could be so many things. It could be a mycotoxin. There's so many things that cause it, but those things that are causing it are known. And the point here is not only do you have the anemia of chronic disease, where your low blood, where you have chronically low red blood cells, okay, chronic anemia, but many of the things that are causing those chronic anemia are also the things that are causing inflammation that's contributing to your chronic disease. So anemia, oxygen, basic. You're going to hear me say, we're going to be on basics for a while, and you're going to hear me say the basics not being attended to are for sure part of what's causing your foray onto the internet to not work. Okay, whether it's a diet, whether it's supplements, whether it's breathing exercises or whatever. So these basics are their treatment, but they're treatment that people don't pay attention to. They're presented to you in a fragmented manner. They're not really connected to anything. You have fibromyalgia and somebody's telling you that you need to breathe better, and you're like, yeah, I need to breathe better because I need to like live or sleep, or I need oxygen so I can feel better. But nobody's really connecting it to the chronic conditions that are coming in and treating it as you would treat a medication, or as you would treat a pill, or as you would treat a diet, or as you would treat, in our case, like brain rehab exercises. It is that important. And so other things that will cause a decrease in oxygen, okay? Low T3. What is T3? For those of you who know what that is, it's a thyroid hormone. So hypothyroidism or Hashimoto's thyroiditis will cause low T3. T3 is the thyroid hormone that gets into your cells, and it actually contributes to this mechanism that we talked about earlier in the mitochondria that will also cause you to not have enough energy. Okay, and if you don't have enough energy, then there's going to be a cascade of things that are going on. You're going to get low blood pressure. You're gonna have your physiology just is not. Everything is going to slow down. Your gut's going to slow down. Your stomach's going to slow down. All of these things are going to slow down because you're not making enough energy, and you're going to be looking at it and going, well, okay, I got low oxygen, and now I'm doing what you told me to do, but it's not coming up. And then you find out you have a thyroid problem, and now you treat that person's thyroid problem. Now their T3 comes up to normal, and all of a sudden the oxygen that they're taking starts working. Now I went through that because I've been, again, this goes back to those of you who want to know why we weren't able to tell you how to get better. Those are vicious cycles. Those are vicious cycles. Do you take care of the oxygen? Do you take care of the T3? Do you take care of the chronic anemia? Because low thyroid is another one of those causes that'll cause the chronic anemia. It'll slow everything down, so you just can't make enough red blood cells. This all goes under the heading of follow the oxygen. This is the first step that we take when people come in, is doing, after we do the history and so on and so forth, and we gather all the data. If the oxygen is low, we have one doctor that just specifically works with those patients on getting their oxygen. We use oxygen here in our treatment. We actually take people in the back, we do brain rehab exercises, and we use oxygen. Part of the reason is we're in Reno, Nevada. We are at 4,000 feet, I think, 4,200 feet right here at the base of the city. And so we have less oxygen here than they have in, say, San Francisco, which is a couple of hours from here. And we noticed that all of our patients' red blood cell counts were high. That's called polycythemia. If you look up polycythemia, you can kind of freak out about it a little bit, except everybody here has polycythemia because we're at a higher altitude. You have to make more red blood cells for the oxygen. And so we started to understand and reason that a lot of our patients needed oxygen simply because they weren't getting it, because for some reason their bodies weren't adapting. And we started using oxygen concentrators. And we put an oxygen concentrator on people while we have them doing their brain rehab exercises. And just from that, we see noticeable differences. We recommend exercise with oxygen therapy to patients now. And that could mean buying a used oxygen concentrator at home and using it on your treadmill or using it on your bike, and you stick it on. And I can't prescribe and I can't tell you how much to do it because I can't do that. Okay, it's a kind of like a malpractice type of thing. So, but I can tell you that it helps. That it helps our patients. It's a very low grade way of increasing your oxygen. So thyroid, anemias of chronic disease, high blood pressure, low blood pressure, sleep apnea. These are the ones that we see that are controllable or that we can address within the framework of our functional medicine model. There are things you can do for low blood pressure, and you want to talk to your doctor about it. You know, there are herbs that you can use to bring up your blood pressure. It's all over the internet. You can use licorice. You can use things of that nature. You can use salt. If you look online, everybody's going to tell you to take teaspoonfuls of salt. Do it with your doctor's recommendations. Talk to your doctor. Your doctor might tell you not to bother. Having low blood pressure is really good. You're not going to die from a heart attack or a stroke. But believe me, having enough oxygen in there is a big deal. Now, those are kind of things we can control. Things we can't control, and I list these also among obstacles to cure if the person can't do this, it can't change, or if they have an irreparable problem. An irreversible problem like chronic obstructive pulmonary disease. We treat people with that. But I warn them ahead of time, we're going to get a limited response because you're not breathing well. Part of your lung is damaged, and we're not going to be able to get enough oxygen into places where we want to. But I don't have like this crystal ball to tell you how well you're going to get. So we've had varying degrees of response. But surely we never get responses as well as we do with people who don't have COPD. Asthma is kind of an interesting one. Asthma, severe asthma can be a problem. We see it a lot in kids. But on the other hand, asthma seems to be more of an immune inflammation type of a situation that's really exacerbated by stress and allergies. And the vast majority of the time, we actually treat asthma. The vast majority of the time, the asthma will ultimately get under control. So we'll actually use supplements that will increase oxygen to the person in a case like that because they don't have enough oxygen going on. Smoking cigarettes. I used to not take people if they were smoking cigarettes. And then I thought, well, it's not fair. I just need to let them know they may need to know that we may not get as good a result. And then we didn't get as good a results. We talked to people about it. I let them know that they would be better off smoking cigarettes. I have people who just stop smoking immediately. When you stop smoking immediately, your blood pressure will reduce usually within about 72 hours, by the way. And so not only does smoking decrease oxygen to your brain, by like about 40%, but it contributes to high blood pressure, which constricts your arteries, which causes less oxygen. Okay, we've used a clinical hypnotherapist to help people stop smoking. It's not something that's going to stop me from taking people on, but it's something that's going to cause me to have to sit down and kind of reassess the prognosis and set some realistic expectations, because those people aren't going to do as well. That's aside from the chemicals that the cigarettes cause. Lack of exercise. You know, you need to get up and walk around. We're going to talk about that in one of the presentations that we're going to do. But you know, right now I'm at a point in my life where I'm working a lot, and I just don't have the time to do exercise the way I'd like to do it. I have a little black dog that runs around here, and I take that dog for a walk every night. And I've got it. Unfortunately, I got a neighborhood that's kind of hilly. And I walk up and down those hills. Sometimes I walk 20 minutes. Sometimes I walk 40, 45 minutes. I do a little stretching. But I get exercise, and I do a couple of just very simple yoga exercises, totally to keep everything flowing, to get oxygen to my brain, to get oxygen to my hands, to get oxygen in throughout my system. So, and then the biggest thing that causes oxygen deficits, people come in here, is stress. And I don't know if you've ever paid attention to how you breathe. Most people don't breathe from their abdomen anyway, which is, I wrote a book called Back to Basics, Power Health Back to Basics, and I have a whole chapter in there on breathing. And the whole chapter is just on one simple breathing technique that shows you how to breathe with your diaphragm. It talks about, it opens with a story about how the first Americans, the first white people that came upon the islands of Hawaii were laughed at by the Hawaiians, and they called them haoles. I think a lot of you in Hawaii know that you call white Caucasian people haoles. And haoles means men without breath. That's what it means. And they were laughing because everybody was breathing, like here, nobody was breathing from their abdomen. Okay, nobody was breathing with their diaphragm. The number one reason people don't breathe from their diaphragm is stress, because when you are stressed, there's something called your sympathetic nervous system, and it takes over, and it kind of paralyzes your diaphragm to a certain degree during the period of time that you're stressed. Well, I'd say at least half of this country is stressed all the time, at least right now, at least based on my observations. Certainly, it's a rare patient who comes into this office with some sort of a chronic condition who isn't in a chronic fight-flight response. But if you become aware of that, you can learn to do some abdominal breathing. We teach almost virtually all of our patients to do this on the first visit or two. You can learn simple abdominal breathing techniques, and you can actually use those techniques not just to oxygenate your body and your brain, but you can use those techniques to calm down that stress response. Because when you do that, it'll calm down that fight-flight response, and it'll allow the relaxation response to come back in. And if you ever happen to be relaxed, you'll probably notice you're breathing from your abdomen. But this is an important part of oxygen. If it sounds silly to you, then I feel bad for you, because we're really, one of the things that I've noticed over the years of doing this, and this is my 40th year, I'm just about to enter my 40th year in practice, is we really are enamored with all the new things that come out, and there's value to many of them, if not all of them, but it's not about the new things. Getting well is not about the new things. Getting well is about is fixing the things that are broke first. It's bowing to nature, and nature says you need oxygen in every cell of your system. You need proper blood sugar. You need proper essential fatty acids. You need a lack of inflammation. Nature says you should only be stressed for very, very short periods of time when you need the energy, and then you should be in a relaxation mode. This may sound silly, but these are the things that we drive home with patients. We give them techniques to do these types of things. And you'll hear me say this a number of times. This is just the first of the basics that we're talking about. But when we fix the basics of oxygen, and when we fix the basics of blood sugar, and when we fix the basics of essential fatty acids, and then fixing the basic of getting rid of inflammation becomes quite a bit more complex in a lot of different patients. But when you get those under control, a lot of times, these mystery diseases that people have come in with start to not be a mystery anymore. A lot of times these patients get 50, 60, 70, 75% better just doing that. And before you even get into the actual functional medicine part of things. So that's oxygen. You know, the basics never go away. The basics will never go away. We are human beings. We have to kind of adhere to certain rules. You're going to know, if you follow this series, you're going to know what all those rules are. You're going to know that those rules are going to dictate your success. If all those rules don't get you better and you're still sick and you go to a functional medicine practitioner, for you, those are your functional medicine practitioners who are watching me, I mean, I don't mean to sound like I know everything, but I've been doing this for a while. We have a lot of people come here after they've been to 10 functional medicine practitioners now. These are the things that are being missed. And if you don't miss them and you do go to your functional medicine practitioner, your functional medicine practitioner is going to find that you get a lot better result with the types of things that they do. So that's oxygen. I mean, I could talk on oxygen for a long, long time. Maybe this will cause you to maybe look on the internet and look these things up and investigate that. Next week but this is following the fuel. Okay, this is kind of like the basics, part one of foundational functional medicine, and this is like part one of 2 parts of following the fuel. Next week we're going to talk about sugar. The 2 main fuels to your system are oxygen and sugar. We talked this morning about food being your fuel, but really the foundational fuel is oxygen and sugar. After we talk about those, then we'll get into diet, and we'll give you our observations on diet relative to people using diets to get well. Okay, and I'll give you we'll give you our experience on it, and diet's one that I always hesitate to get to because there's a million of them out there and everybody's got their variation of every single diet. But I think I can break that down for you. So next week will be sugar. It will be blood sugar. It will be high blood sugar. It will be insulin resistance. It will be metabolic syndrome. It will be reactive hypoglycemia, and how that plays into so much of what people are coming in here with. So thank you for watching again. If you have any questions or comments, you can send them to powerhealthtalk.com. And we are looking for direction. Yeah, I want to make this valuable time for you. So if you have anything that you specifically want to hear about, this morning I heard that we specifically want to hear about diet. We will definitely cover that in either a whole segment or as part of a segment, and we'll let you know when that is. So until next week, thank you for watching, and take care.